I'm Dr. Richa Bansal. I'm a consultant oncosurgeon, that is female cancer specialist surgeon working at Apollo Cancer Center, Navi, Mumbai. Let me share with you all that the month of September is recognized as the Gynecological Cancer Awareness Month, and it is essential to be celebrated as it gives us an opportunity to share with you all important information on various aspects of gynecological cancers like the risk factors, common warning symptoms and signs of gynec cancers, and also various preventive strategies that are very easily adoptable. Now, what are gynecological cancers? These are the cancers that affect the female reproductive organs like cervix, uterus, ovaries, fallopian tubes, vulva, and vagina. It is essential to discuss about gynecological cancers because every woman is at risk, and early recognition of symptoms and signs of gynec cancers can prevent the cancer from progressing to a critical stage. Now let us talk about some gynecological cancers in detail. Cervical cancer or cancer of the mouth of the uterus is an important public health problem in our country, as it is the second most common cancer that affects the women of our country. Infection with human papillomavirus, that is HPV, is the most important factor in the causation of cervical cancer, and the women for whom the HPV virus remains persistent in the genital tract for years are the ones who are at the maximum risk of developing cervical cancer. Hpv test and the pap smear test are the two tests available to us which can identify the women with persistent HPV infection and also the women in whom HPV virus is causing some abnormal cell changes that can be picked up on pap smear test. These abnormal cell changes developing in the cervix, which are picked up by the pap smear test, can be easily treated, and thus future development of cervical cancer can be prevented. Now, another important aspect of cervical cancer prevention, which we all should be aware of, is Hpv vaccine. World Health Organization recommends Hpv vaccine for all the adolescent girls between 9 to 15 years of age for prevention of future development of cervical cancer. Now coming to the common symptoms of cervical cancer. Early stage cervical cancer does not give rise to any symptoms, which is why regular screening is so important. Symptoms arise only when the tumor has grown in size or has become locally advanced, and the symptoms noticed at this stage are abnormal vaginal discharge, especially if it is foul smelling, pain and bleeding during sexual intercourse, any postmenopausal bleeding, and so on. Now coming to uterine cancer or cancer of the womb. Though uterine cancer is most commonly thought to arise in postmenopausal women, the incidence of uterine cancer is also rising for women in their 30s and 40s. And the most important risk factors for this rising incidence of uterine cancer are obesity, delayed marriage and hence delayed childbirth, having less number of children, not having any children, and so on. Routine screening for uterine cancer is not recommended, but it is very important for the women to be aware of common symptoms of uterine cancer, which are heavy menstrual bleeding, any bleeding or spotting after a woman has achieved menopause, that is postmenopausal bleeding, pain or pressure felt in the pelvic area, and etc. Ovarian cancer is the most deadly of all gynecological cancers, as more than 80% of women who are diagnosed with ovarian cancer have already advanced stage of the disease at the time of diagnosis. This is because early stage ovarian cancer hardly gives any symptoms, or it causes many very non-specific symptoms. And these symptoms are dull ache in the abdomen, abdominal bloating, feeling quickly full after having even small amount of food, pain or pressure in the pelvic area. So women should be aware of these common symptoms and signs and should never ignore them, especially if these symptoms have been persistent or are worsening in severity over a period of time. Vulval and vaginal cancers are relatively less common. The common symptoms are abnormal vaginal bleeding, noticing a lesion or lump or unhealthy skin changes over the vulval skin, Early diagnosis and appropriate treatment can give us long-term cure. Hence, being aware of these common aspects of gynecological cancers would go in a long way in saving lives from cancer. Thank you.